Hey, how's it going? It's George from Joint Effort Exercise. I just wanted to share a presentation that one of my amazing colleagues and teammates, Haley Kopchak, created, which is, as you can see in the title, the effects of exercise on osteoporosis and osteopenia. All right. So this is a photo, obviously not of me. This is the wonderful Haley. And just some brief information about her. She graduated from Central Connecticut State University in 2020 with a degree in exercise science. She's now a certified exercise physiologist, which is a very impressive certification to hold. She's worked a total of 5 years in the, I'll call it medical exercise field, which includes about 2 years with us at Joint Effort. And as you can see there, she thoroughly enjoys her position, the position as exercise physiologist that she holds up in our Old Saybrook, Connecticut location. All right, so we always like to ask questions during these presentations. So, just to get a kind of a feel of the group and how many people have been told by their PCP or endocrinologist that they're at risk for osteopenia or osteoporosis, so bone loss. So obviously this is just a presentation, so I'm not going to be asking you that question, but it just, we normally see about 80% of the people that are in these presentations say that they are, they have been told that they're at risk. Obviously, we don't like to be asking questions about people's medical history, but they saying that, at risk is a good way to, to figure out, who's probable of getting this, or one of these. So just some statistics, about 10 million people in the US have osteoporosis now, and 43 million are at increased risk of developing it, all right? We do see it more common in women than in men. And so just the people that are most prone. So the people that are most prone to osteopenia, osteoporosis are those who are sedentary. So that's unfortunately a much higher number than, than we as exercise professionals would like to see. So it's about 80% of our population does not currently get the amount of exercise that they need throughout the week. If they have family history of osteopenia, osteoporosis, people that have are smokers or or previous smokers, drinkers, and postmenopausal women, white and Asian women are the number one being prone to this. These especially petite, those with petite builds. All right, so just something funny. Do you know anyone who fits into one or more of these categories? I'm sure you do. If you may even be one of them, so that's why we're here to learn what we can, what we can do. All right, so during the presentation, we'll be reviewing the causes, what that actually means from a physiological perspective, some exercise and activities that you should be avoiding if you have either of these conditions. The way that strength training does help with help with these conditions and helps to rebuild lost bone tissue, and how to actually do so. So how to do so safely. All right, so what's the difference between the two? So osteopenia is like the beginning stage of osteoporosis. So it's just reduced bone mass of lesser severity than osteoporosis. So this can stay this way. It doesn't always lead into osteoporosis. So you can you can stick without the osteopenia if you do the right things to to slow down the the development of more bone loss. So it's not a disease. So this is just a condition at this point. But as I said in the previous slide, it is, it does not have to develop at all times into osteoporosis. So you can see down in those circles below, the normal bone has just, doesn't really have too many of those large, spaces. And so normal bone doesn't have a lot. The osteopenia is just a little bit of, increased bone loss, and then osteoporosis and the severe osteoporosis have more significance. So that's actually what the bone looks like. All right, osteoporosis is, as it reads, it's the after osteopenia if it's not, taken care of, a medical condition which bones become brittle and fragile from loss of tissue, typically as a result of hormonal changes or deficiency in calcium or vitamin D, or as we said in previous slides, from a sedentary lifestyle or lifestyle choices that, one makes throughout their life, that cause, this type of bone loss. All right, so these bones are at greater risk of breaking, as you can see. Can even happen just from falling from a standing position. So it doesn't have to be, something as severe as, falling while you're in motion or downstairs, things like that. It could just be something as simple as tripping and or falling from a standing position. So this is when we, we really want to, take better care of ourselves and start improving our balance, strength, and overall functionality to avoid falls, which ultimately will prevent fractures. All right, risk factors. So Caucasian and Asian women age 65 and over are, again, most prone. Those with, again, those petite builds. Men with low testosterone levels. Anyone weighing less than 125 pounds. And as I said before, the petite frame. So those are the ones that are most, most prone to having it and suffering a fracture as a result. And anybody who has already suffered a fracture. All right. It also takes people that have undergone bariatric surgery and kidney failure, all these other conditions here. I'll let you read through those. And those that take oral corticosteroids on a daily basis or other high-risk medications. All right, here are just some symptoms and basic recommendations. We'll get into, some others that are, a little bit later in the presentation. So often called the silent disease because a lot of people don't know that they have it unless they're being screened, which I highly recommend anybody, that's, over the age of 60 that, to get screened. Healthy diet and exercise will help prevent bone loss and strengthen bones that have already become weak. We've had many people over the course of our, of our 10 years in existence at Joint Effort, have actually reversed, a lot of their bone loss and, went from having osteopenia to really being now on the, on the kind of the cusp of having osteopenia, and osteoporosis, again, strengthening up their bones to a point where their PCP or endocrinologist has said, this is, it's really great. You don't need to be as concerned anymore about your, this condition because you're doing so much better. So not only are your muscles becoming stronger, your balance improving, your stamina, energy, confidence, your bones are getting stronger as well. So you don't have to restrict, your activities of daily living as much as you, were in the past as a result of your fear of falling and breaking something. So that strength training does help, which again, we'll go into in just a little bit. And then, you should be tested every 2 years. So after that initial screening, you should be tested every 2 years. All right. So these are all people who should get screened: women 65 and over, men 70 and over. If you're over 50 and have had a fracture, women going through menopause or have low body weight, and high-risk medication. So we've gone through this. Just want to reemphasize. All right. So here are some prevention strategies that you can take to minimize your likelihood of developing these or help to prevent any injuries as a result of them. So largest controllable determinants of bone health are nutrition. So proper nutrition, want to make sure, that's important for everything, but it also aids in improving your bone health. Physical activity, weight, smoking cessation, and avoiding excessive alcohol use. So again, all of those risk factors, if you do not do those, it's going to help you to prevent developing these conditions. The food you eat can affect your bones. Learning about the foods that are rich in calcium, vitamin D, and other nutrients are important for bone health, and overall health will make you will help you make healthier food choices every day. So so just making sure that you're getting enough of these foods. So as you can see here, milk, cheese, and other dairy foods, green leafy vegetables, spinach, soybeans, tofu, plant-based drinks with added calcium. So supplementing a little bit is helpful if you're not getting as much vitamins as vitamins and vegetables with vitamins, minerals as you would like to. Adding those drinks in certainly helps. Nuts, bread, and anything made with fortified flour, and fish. So just a little diagram on the right there that shows some of those choices that you can start making. All right, in our favorite topic, and I want to reemphasize, I did not make this. Haley made it. She already did the presentation, so I didn't want to ask her to do it again. So I'm just going over all of her work. So I want to reemphasize that she did a wonderful job. All right, so the benefits of exercise with osteopenia and osteoporosis. So many who've been diagnosed with bone loss are afraid to exercise as a result. But again, it is the only way that you can help to improve your strength, balance, and your overall functionality, and the ability to do what you need and want to do safely over the course of time. So exercising in the proper way is literally the only way that you're going to be able to maintain your functionality. There's no pill, potion, powder that will do this for you. So, obviously not any type of exercise, and not just, go out there and figure it out. You need to have, some professional guidance on how to exercise safely and how to start safely, most importantly, to avoid unnecessary injury. That obviously you're exercising not to do that. So just have some guidance, to get started. All right, specifically functional strength training will result in improved bone strength. Obviously, that's why we're here. Muscular strength, balance, agility, gait, posture, reaction time, stamina, mobility, confidence. So all of these things will happen as a result of the functional strength and mobility training, that we promote as much as we possibly can at Joint Effort. It will happen. So again, we're here for bone strength, but think about how everything else impacts your day-to-day life that's on this list here. And having that will help you to, have a more positive quality of life in the future. All right, and then at the bottom, all of which will decrease your risk of falling and suffering an injury as a result of low bone density. So even if you do have osteopenia, osteoporosis, still doing, this type of training will help, to reduce the likelihood of a fall. So what actually happens to bone when strength training? So when muscles contract against resistance, the stress that the muscles and tendons put on their attachment points, which is the bones and the joints, cause the new bone forming cells, which are osteoblasts, in those areas to move into action. So just like with strength training, when you're damaging muscle tissue slightly, your body automatically goes into a regeneration phase and a repair phase after those sessions to make your muscles stronger. So the next time that you do those, you'll be better able to do them. Same thing happens with the bones. So, so the muscles contracting and the tendons pulling on the bone causes slight stress to the bone. And then those osteoblasts go in and they start to create more, new bone tissue and stronger bone tissue. So that's what is actually happening from a physiological perspective. So when you add resistance to your routine, your muscles release calcium, magnesium, and other minerals that strengthen your bones. So that's why this is so important. And again, at the bottom, it says functional strength training is so important as it works all 6 major muscle groups in all planes of motion against resistance. So it is helping to strengthen up your bones in a way that mimics your activities of daily living, that is going to ultimately make you, again, function better and more safely, and prevent unnecessary strains, sprains, falls, fractures, so on and so forth. So I can't emphasize enough the importance of this style of training. All right, reminder, these are all the things that were on the last slide. I don't have to, or the 2 slides before, so I don't have to repeat them. But again, wouldn't it be nice to have all of this, as you age? So if you're in your 60s, 70s, 80s, or even 90s, and you're looking at this, the type of training, that functional strength and mobility training, will help you to improve. Will, not may, it will help you to improve all of these. So again, that's why we are here to promote it. So recommended exercises for those with these 2 conditions. So lower body strength training. So lower body is obviously the legs, the hips, the glutes. So large multi-joint compound exercises, so conducted in weight-bearing positions and involve extensive muscle recruitment, have the potential to apply large loads at clinically relevant bone sites such as spine and hip. So I want to make this point clear. You want to be loading these muscles more than what your body weight is. So although body weight squats, body weight lunges, other lower extremity exercises that are just using your body weight are good and better than nothing. You really should be doing exercises that load those muscles more than what they're used to carrying every day. I hope that makes sense, because if you're just doing what they carry every day, yes, it's going to be better than doing nothing and just walking. But if you load them properly using machines or or weights, or whatever you have that goes up over your your body weight, it will help to improve the bone strength and muscular strength faster and more effectively. Right. So some examples of lower body exercises. So a deadlift, and everything should start. And I just said to overload the muscles, but especially if you have osteopenia or osteoporosis currently, you want to start at a moderate intensity, very conservatively in the beginning. So this is why it's so important for you to have somebody guide you through the beginning stages of your routine development. It will help you to prevent any, again, unnecessary injuries, sprains, strains, and help you to get to your goals more safely and more effectively. So deadlift, glute bridges, which both work the glutes and the muscles in the hips and the low back. Squats, so you see this this woman, I'll say, doing squats, but she also has bands around her knees, which are going to help with the bone density in her hips. So that's a little bit added resistance going out away from her body. And single leg exercises. So a lot of the times while we are doing these types of exercises, we're using both legs at the same time, which sometimes our more dominant side will take over for the non-dominant side. So by doing single leg movements, or what we call unilateral movements, it can not only help with there being a equal amount of resistance, but it can also in terms of the legs or whatever extremity is pushing, but it can also help with balance as well. So so very important to do unilateral exercises as well. So upper body strength training. So obviously smaller muscle groups, but still multi-joint compound exercises. So using machines, dumbbells, resistance bands, medicine balls. So this is where it's really important to have equipment available to overload the muscles that you're isolating in your upper body. So applies resistance to the muscles and bones of the upper body, especially those prone to injury. So if you think about somebody that has fallen, that has these bone loss conditions, they often fracture their arms, most commonly probably their wrists, shoulders, elbows, and even neck. And I consider neck part of the upper body, obviously. But those are all areas that can be strengthened through this style of training and help to prevent, everyone falls. It's just fact of life. So by doing this type of training, it will help you to prevent falls. But when you do fall, not if, when you do fall, it will help to prevent you from getting injured when you do, because you're strengthening all of these areas that that I'm listing here, as well as what we did with the lower body slide, that, these muscles will be stronger and able to slow down your fall and potentially even catch you, from falling, which will keep you from suffering a more severe injury as a result, if that makes sense. So just slowing the fall down, or even potentially saving you from falling. But the injury, that your likelihood of getting injured seriously, is far less if your muscles and bones are stronger. Some upper body exercises. So we have the chest press machine, which is a very helpful machine for the upper body, which is the same thing as doing push-ups. Most people that we see only people really, I would say the average age of our client is around 70. So most aren't strong enough at this point to do push-ups. We do have a handful. But the chest press machine is very useful because it mimics the same movement as a push-up, but you can really you can use a lot less resistance than what your body weight would be there, and then gradually build up. Shoulder press, a lot of times we don't go above our head. So that's a really good exercise to prevent, to again increase bone density, but also improve mobility, as well as overall stability in your shoulder joint. Rows, those are very good. So that's, you're pulling, I'm sure you've done those in, therapy or other fitness settings, where you're just pulling bands, towards your chest. And those are really great for posture, really great for, thoracic vertebrae strength and cervical vertebrae. So your neck strength, and, just overall great exercise. Pull downs, very similar. Bicep curls, tricep extensions. You see all these exercises. So these are all examples of exercises that we prescribe to help our clients to improve their strength and, bone density in their shoulders, arms, elbows, wrists, so on and so forth. So I mentioned posture earlier. So practicing good posture is not something one normally thinks of when trying to combat the effects of aging, but it should be, because it is so important. Standing up nice and straight, is just, aesthetically better. Everybody wants to be standing up straight, and it's not something that has to happen as a result of aging. A lot of times it's poor core strength. Which a lot of times people think of core strength as just the abdominals, but it's also all the muscles front and back, really from your chest to your knees. So you want to, chest, knees, chest, hips, maybe. But so you want to do both sides. So when you think of core strength and improving your core to improve your posture, we're talking about muscles of your lower back, your glutes, your upper back, that help you to keep your shoulders back and standing up as straight as possible. So when you're standing up nice and straight, as you're walking, you can see everything. You're not looking down at the ground. So it's really important to maintain good posture during this process, to help you, reduce the risk of falls and, just look better overall. Right. So it allows critical components within the body, such as muscles, tendons, and ligaments, to effectively do their jobs. When these components are functioning properly, they are able to provide the proper support for all bones within the body, including the spine, shoulders, hips, and legs. All right, so we all know, or may have a posture that's either here or moving towards here, this direction. So we want to do all we can to prevent or try to reverse this. And you can do that through proper strength training, and mobility training, I should say. So hyperkyphosis, exaggerated forward thoracic curvature. So thoracic just means the part of your spine that's kind of in the middle of your back. So we have lumbar down here, at the bottom, like right above your rear end. And then we have thoracic, which is the middle of your spine. And then we have cervical, which is your neck. So this is a an exaggerated forward thoracic curvature. Either of these is sometimes referred to as the osteoporosis posture because, again, muscles and bones are starting to break down, which is causing this posture. All right, so some exercises: cat cow, wall angels, thoracic rotations, and rows are all exercises that we prescribe to our clients who come in that have this posture, again, to try to help reverse it, and just help them to, to feel better overall. A lot of times this, kind of posture leads to neck discomfort, headaches, low back pain. So many symptoms come as a result of this. So it's really important to get it under control. So as I mentioned before, core strength training, it contributes to good posture and overall back health, works postural muscles in your abdomen, pelvis, and back, and reduces risk of compression and other fractures of the spine. So many times we'll meet with clients and they'll say, I used to be 5'7" and now I'm 5'5" or 5'4" or 5'3". And that's a result of, a lot of the compression changes and fractures in the spine as well as their posture. So, this is something I'm not saying, yes, we can get you back to 5'7", Mrs. Jones, but we can, we can certainly help you to improve your core strength, and maybe you'll gain a couple inches back as a result of your posture changing. So it's not an uncommon outcome of this type of training, but the aesthetics are not as important as as the improvement in safety. So that's really what we're looking for when we're developing a program for clients. So here are some core strengthening exercises. A plank, so that's for pretty much every major muscle group from your toes up to your shoulders. Side plank, that's a good one for obliques and hips. We have the Palloff press. So these are all really good exercises for people with osteopenia or osteoporosis because they're what are called isometric. And what that means is the spine is essentially staying still. There's no excessive twisting. There's no excessive bending or extension or flexion, which sometimes can cause issues. So during the initial prescriptions for our clients who have osteopenia, osteoporosis, it's really important that we avoid those twisting exercises. So these are a lot of, the movements that we do for clients when they're first starting. As we progress, actually we determine kind of where they're at from a functional perspective on day one, and then we make the prescription based on that. But these are just some examples of exercises that one can do if they have osteopenia or osteoporosis without fear of doing any excessive damage to their lumbar vertebrae or thoracic vertebrae or cervical vertebrae, really anything in the back. So another very common type of training inside of this is balance and stability exercises. So these all do help with bone strength as well, but we're looking for improvements in balance and functionality as well to prevent, again, I've said it loads of times, falls and fractures. So heel toe walks, marching in place, sit to stand, step up, single leg balance exercises, all very good exercises to improve, again, at the top, both balance and stability. Helps to increase confidence in your willingness to do things that you once enjoyed doing, or maintain the ability to do the activities that you enjoy doing. And just very important to have in your routine. Stretching, I feel like stretching is the most overlooked component of physical fitness, and something that, especially people that have bone loss, or, are in your 60s, 70s, 80s, 90s should be doing to improve, your flexibility, your joint range of motion, your, muscular range of motion. It's really, really important. Your reaction time. So best performed effort or muscles are warmed up after exercising. So even when I'd say as close as it was as I was in high school, but it's not that close. It's 20 years at this point, which is sad to say. So we used to stretch before we started playing basketball, whatever the sport, the sport was. But we found over the course of time that it's best performed after muscles are warmed up. So you want to do a dynamic warm up, do some cardio, and then then your strength and mobility training, and then imbalance training, and then stretch afterwards. So you want to hold each stretch for 20 to 30 seconds. This is called static stretching, where a lot of the times people in the 70s, 80s, they did what's called ballistic stretching, which was getting to a point where you felt a stretch and then kind of bounce, but we have found that that's not as effective as a static stretching. So you want to make sure you're holding each stretch for 20 to 30 seconds. Again, this increases range of motion, allows you to move with more agility, so improving your reaction time, and helps to protect your joints and prevent injury. All right, so what you should avoid, we've spoken to hundreds, if not thousands of people over the last 10 years. Yeah, definitely thousands of people over the last 10 years. And not many, but I have had some people come in after working with a trainer that said that, the trainer had them jumping up onto a box, or doing these, jogging, or doing things that just, there's no reason to do them. If you're in your 60s, 70s, 80s, jumping up onto a box is just not smart to do. Just that there's no other way to put it. The likelihood of getting injured is far greater than any any positive result that you're going to get out of it. So let's avoid that. So any jumping, running, or jogging, let's try to prolong the life of our joints as much as possible. So brisk walking and power walking are safer and, again, just as effective. If you're getting your heart rate 20 to 30 beats per minute above your resting heart rate, that is perfect. That's fine. There are ways to calculate your target heart rate zone, which is a whole nother presentation. But if you can get them 20 to 30 beats a minute over your resting heart rate through brisk walking or power walking, that's just as effective as doing either of those on top. So as I mentioned earlier, twisting movements against excessive resistance should be avoided, especially in the beginning stages of you doing this type of training. Can be implemented over time, but again, those isometric movements that I mentioned in a couple of slides before are best for strengthening lower back and those twisting muscles of the core. So your obliques are you can still be strengthened without twisting. Movements that flex at the hip against heavy resistance. Again, this is something that you can do over time, but not right out of the gates. There are ways to strengthen up the muscles of your low back and your glutes and your hips without doing that. And you want to do everything in a slow, controlled manner. So avoid quick, jerky movements. You don't want to be getting to a point where you're at your full range of motion and you're letting your joint stop the movement rather than your muscles stop the movement. So if you're, doing a kind of row that you don't want your arms to fully extend in a quick movement, you want to be in full control and start and stop the movement using your muscles. Treatment, screening, physical examination, and discussing the person's history. Healthcare provider may recommend medication or hormonal therapy. There were a couple comments in the initial presentation that we did that there was a difference and a benefit of doing both the medication as well as the strength training. But we have had clients over the years just come in and say, I want to try strength training without medication. I already take enough medication and I would just rather not. So their PCP deemed that okay. and they ended up doing great. And, one woman that stands out most, she went back to doing, she wasn't riding her bike anymore up in Cape Cod. That was one of the things that she'd been doing since she was a, young girl. And she worked out for a couple of years with us, did the strength training, balance training, and she did end up reversing her bone loss, and was now just kind of at risk, I'll say, of having osteopenia or osteoporosis. And she went back to doing, going bike riding again. So it was kind of a game changer for her to do that. So she did it without the medication. I'm not saying don't take medication by any stretch of the imagination. Listen to your physician, but it has worked. It has worked without it, depending on where you're at. So we just want to make sure that osteopenia, if you do have that it doesn't progress into osteoporosis, because that's when it gets a little bit scarier. All right, so here's the prescription for it. And what I mean by that is what you should do and how much. Okay, so the type of training that you should do, so it's a combination of strength, functional, mobility, and flexibility exercises. So the volume, and actually I should have had cardiovascular training on the top of that as well. So the volume amount per week, 120 to 150 minutes of cardio. Really, if possible, the best exercise that you can do for osteopenia, osteoporosis is walking. It is a load-bearing exercise, and it's going to help with core strength, posture, as long as you're walking with both of those. Balance, and again, has that impact, lower impact on your joints than running or jogging or jumping. But if you can't walk, any type of cardio is still good against some type of resistance. So whether that's an elliptical machine, a bicycle, really any type of a rowing machine, any type of cardio. The only type that is not going to help with this as much as we would like, or probably the least, is swimming, although it has excellent health benefits otherwise. It's amazing lower body, full body cardiovascular exercise, but the buoyancy factor of the water is not going to provide much bone strengthening benefits. So again, although I still do recommend it for cardio, it's just not going to have the result on the bones as much as walking. All right, so along with the cardio, 2 or 3 functional strength training sessions. So those could be as little as 30 minutes. It does not take long. They should work all 6 major muscle groups. So the shoulders, the arms, the chest, the core, the back, and your legs. So you want to make absolutely sure that you're working all 6 major muscle groups with your functional strength training sessions, and in all planes of motion. And finally, as much mobility and flexibility training as you can possibly do. So that's the type of training you can do every day. Don't have to, give a day in between like you do for the functional strength training sessions. You could really do that as much as you can, and I recommend that you do. So the intensity determined by an exercise professional I have that underlined and in bold for a very specific reason, for your needs and capabilities, as you can injure yourself with the wrong movements or intensity. So that's very, very important to make sure that, you don't just walk into an exercise class and start to do everything that the whole group is doing if you have osteopenia or osteoporosis, because I always make the analogy in these presentations that would be like walking into a party and you have a food allergy and just going and eating anything that's on the table without asking the ingredients, and just starting to stuff your face. You want to have a program that is designed specifically for you and what stage you're at in your fitness, but also your health, and your bone health, which is what we're talking about. Because the last thing that you want to do is try a strength training routine and end up getting hurt as a result. That's obviously not the goal. So make absolutely sure that you find a program or a person that has experience with working with individuals that have osteopenia or osteoporosis, if you do have it, or have experience in helping people to prevent it through if you're at risk. Okay. So, so important. All right, this is a funny picture of our team and in Old Saybrook and some of our amazing members. So exercising with osteopenia or osteoporosis can be dangerous. Find people who have experience. I said that earlier. It is so essential to prevent and or slow down the breakdown in bone and can help you to live a healthy, happy, and active life. If you have any questions about the content of this, or if you have any questions in general about our program or about your specific situation, please feel free to email Haley at jointeffortexercise.com. She will be happy to answer any questions. So I hope you enjoyed the presentation. Again, Haley did an absolutely amazing job with this, and I feel privileged to have her on my team and to continue to work with her and the rest of my amazing team in the future. So hope you enjoyed this. Again, if you have any questions, Haley at jointeffortexercise.com about the content. If you have any questions about the program after watching this, you can always email me as well. It's George at jointeffortexercise.com. I hope you enjoyed it and talk to you soon. See ya.